Ontario's hospital unions wheeled out hospital beds onto the front lawn of the Durham Hospital today to try and get more people talking about healthcare days before Ontarians head to the polls.
Right here in Ontario, we have 250,000 people waiting on a surgery list. Now, can you imagine if you've been waiting for surgery and the list just continues to grow?
The Ontario Council of Hospital Unions brought their stretcher tour to Durham and Walkerton today. Both communities have seen their share of healthcare problems. Walkerton made headlines in January after more than 1,000 people lined up in a snowstorm for a shot at a family doctor. Durham's hospital saw its emergency department hours reduced from 7 to 5 last March, and then in June, all 10 of Durham's inpatient beds were moved to other hospitals.
There were no members of the community consulted. There were no members of the community present. The local elected representatives were not even told until after it was over. And they made the decision to do this. They can't make decisions like that without the assent of the Minister of Health. So, I think it's time to look at that relationship.
The Ministry of Health says they are spending more than any other Ontario government ever has on healthcare, and many key health indicators are beginning to improve, including a decline in the use of agency nurses. But residents are frustrated that local Conservative candidates, especially in Bruce Grey Owen Sound, have not appeared at any healthcare-focused all-candidate debates leading up to Thursday's election.
I think we're seeing what we suspected, that it is driven right from Queen's Park, right from the Ministry of Health, that rural Ontario's healthcare is not important.
What the people at today's stretcher tour stops in Durham and Walkerton want to see is a more responsive Conservative government or a different government altogether come Friday.
We're hoping to see that people will vote for change, or at the very least, if they get back in, cut the majority, and for God's sakes, please get a new health minister.
We have community members who are waiting for care, who have spent their tax money to build this hospital, and they want answers to why this emergency department keeps closing. Why don't they have family doctors? Why can't I have surgery at a reasonable time? And this is the stuff that we wanted to talk about prior to the election.
In Durham, Scott Miller, CTV News.